Dr. Richard Bosshardt, a retired plastic surgeon, has been at odds with the American College of Surgeons since 2020. It all shifted when he applied for fellowship in the American College of Surgeons, an honorary title that allows the use of the letters FACS after one's name. However, things took a turn when the ACS adopted critical race theory into surgery following the George Floyd killing. The ACS claimed that surgeons were racist, and the practice of surgery was racist, citing disparities in outcomes for black patients. Bosshardt strongly disagreed, arguing that there are many reasons for disparate outcomes, and racism is not the sole reason. Bosshardt's concerns were further exacerbated when the ACS promoted the concept of racial concordance, which suggests that patients would receive better care from surgeons of the same race. He finds this idea despicable, as it is essentially reinstalling segregation into surgery. He notes that there is no scientific evidence to support the idea that racial concordance leads to better outcomes in surgery. Despite his efforts to express his concerns, Bosshardt received no response from the president of the ACS. He then posted on the ACS website, stating that he would leave the organization if it continued to embrace anti-racism and DE. This generated a massive comment thread, with 75 individual surgeons and over 1,000 comments. Two-thirds of the surgeons who engaged weighed in favor of Bosshart's position. However, the leadership of the ACS refused to engage with Bosshardt's concerns. Instead, they reached out to him for a Zoom call, which included the new director of diversity, Bonnie Mason, and a regent of the ACS, Tim Eberlein. Bosshardt's beef is not with the ACS or his fellow surgeons, but with the leadership, who he believes are pushing an ideology that supersedes factual science. Bosshardt's experience has left him disconcerted, as he believes that surgeons should be professionals who can have conversations without a chaperone. He brought a colleague, Celia Nelson, a Jamaican-born black female general surgeon, who shared his concerns about diversity, equity, and inclusion, or DI, in the field of surgery. The conversation was civil, but Bosshardt was later banned from the ACS Communities and Members Directory, as well as his own private voicemail box, for allegedly using disrespectful language and posting non-clinical material on clinical forums. Bosshardt disputes these claims and has asked for examples of his supposed wrongdoing, but the ACS has refused to provide any. He appealed the ban to the Board of Regents, but they upheld it, claiming he had received due process. Bosshardt suggests that the consequences of this kind of thinking are dangerous to public health, as it could lead to a lowering of standards for surgeons. Bosshardt agrees, stating that the ACS has already lowered standards for surgeons, which is evident in the deteriorating quality of training for young surgeons. He shares an example of a fully trained surgeon who was incompetent in closing an abdominal wall, and another who had never performed an axillary node dissection, a basic operation that every general surgeon learns. Bosshardt attributes the decline in quality to a combination of circumstances, including the reduction of residency hours in 23, which has resulted in surgeons being less prepared for the demands of the job. He emphasizes that the issue is not about him being banned, but about the impact on public health and the need for excellence in the field of surgery. The training program for surgeons is a 5-year residency program, where the first 2 years focus on patient care and learning how to take care of patients before and after operation. However, a study found that 80% of graduating general surgeons were not going into practice, but instead were pursuing fellowships. Some residents couldn't even handle tissues properly, or sew correctly. The training system is failing to produce competent surgeons, and the problem is being exacerbated by the overlay of racial mandates. The American College of Surgeons is trying to address this issue with a mentorship program, but it's not enough. The standards for admission to medical school have been dropped dramatically for race reasons, and the medical licensure examination has been changed from a graded exam to a pass-fail system. This means that students can pass the exam even if they're only above the bottom 5% in grade. Despite this, some students are still failing the exam multiple times and are being put through medical school anyway. This is leading to a shortage of qualified surgeons, with the USA currently short of 1,200 trauma surgeons. The situation is dire, and it's not just a matter of numbers. It's a matter of quality. The lack of reporting of complications is also a major issue, as most surgery is done as an outpatient procedure, and complications often occur after the patient has left the hospital. Bosshardt had to present a log of his cases to the examiners, who would then select cases to examine him on. He mentioned that he's seen cases where surgeons take too long to complete operations, which can lead to complications. He cited an example of a breast reduction surgery that should take around 3 to 4 hours, but was taking 7 to 8 hours for some surgeons.
Tucker Carlson pointed out that the longer the surgery, the more potential complications.
Bosshardt agreed, stating that the Centers for Medicare and Medicaid Services, CMS, have recognized this issue and are no longer paying for anesthesia beyond a certain time. This is an attempt to penalize surgeons who take too long to complete operations. Bosshardt wants to be a wake-up call to his fellow surgeons, promoting excellence in surgery and pushing back against liberal ideology in the field.
Carlson expressed his concern that surgeons are going along with clearly illogical and unreasonable suppositions, such as the idea that a black female patient to access the complete 12-minute summary and unlock detailed insights for each topic discussed in the video. Please subscribe to Quick Podcast Summaries on Spotify and Apple Podcasts with free trial. Happy listening.